In 2015, the Gauteng Department of Health decided it was going to save money by transferring almost 2,000 mental health patients out of state-subsidized care at a private hospital. And it would move these patients into either state psychiatric facilities or, for the most part, community-based organizations. But it turns out that most of these community-based organizations weren't equipped to deal with mental health patients.
So what is the most shocking part of the Health Ombudsman's report?
I think the most shocking part is at the multiple stages at which people hid information. So the Health Ombudsman talks about not getting information from NGOs, not getting information from the department. He alleges that the head of department actually tampered with evidence. So the reason that the number is expected to climb in terms of deaths is that NGOs haven't released all the figures. And so there are likely bodies in state mortuaries that have been sitting there for months that are unclaimed and families have not been told.
So how did the former Gauteng Health MEC lie in all of this?
Latani Matlangu consistently told people that 36 patients had died. The time that she first announced that, the death toll was already at 77. Becky Sisa previously interviewed the MEC for Health about this, and we asked her in November how many people have died, and she said she could not give us a figure off the top of her head. We asked her repeatedly, how are you monitoring these patients? And she gave answers that, if you know the health system, didn't really make sense.
So in the report, the Health Ombudsman states that all of the 27 NGOs that these patients were referred to were unlicensed. Now, how is it possible that the Gauteng Health Department could not establish whether any of these organizations were licensed?
In November, I asked the MEC that. She said it wasn't her job to visit the NGOs and it wasn't her responsibility. Here's what she said.
I've never been to any of the NGO. I don't know how they look like. I don't know the report we received that, okay, this NGO qualifies, whatever. So I've not visited NGOs, and I think it should be not in my responsibility as a MEC.
So were these licenses that the NGOs were issued with, were they fraudulent, or how did they get these? Because they're described as unlicensed, but it seems that the department said they had some sort of license.
So what the report points to is that senior Department of Health officials would, in some cases, identify very, very small NGOs and then would encourage them to get more patients so that they could license them. These licenses were then given out by a senior official who wasn't authorized to do this. The Health Ombudsman confronted senior officials who said they knew about the problem but hadn't had time to fix it. After the Ombudsman left, senior officials went around to each NGO, collected the old licenses, and issued them with new licenses that had the appropriate signatures.
Is this happening anywhere else in the country?
In October, we did hear of reports in the Eastern Cape where organizations were having patients transferred out into community-based care. The Department of Health denied this and said that no deinstitutionalization, which is what it's called when you take patients out of hospitals and put them into facilities closer to home, was happening. But in November, there was a high court interdict to stop the closure of certain frail care centers in the Eastern Cape. And the reason why you should care is that this deinstitutionalization is actually a national policy. It's a great policy, it's happening all over the world, and it's backed by the World Health Organization. But the key is really in implementation. And experts say that we're pushing patients out of healthcare facilities too fast without building the capacity we need in communities.